Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Kenneth Botelho. He is the founding director of the Doctor of Medical Science program at the College of St. Scholastica and a physician assistant. Today's Kevin MD article is Federal Graduate Loan Caps Threaten Rural Healthcare Access. Kenneth, welcome back to the show.
Thank you so much for having me again, Kevin. I'm happy to be here.
All right. Tell us what your latest article is about.
So our latest article, it takes two different aspects of the more recent quote unquote big beautiful bill that was passed and talks about a paradox that exists within that. And so I'd be happy to go into more depth. This really started as I've been involved in rural health and access to care in those places. And so I'm very familiar with the rural health transformation plan that's within the bill. What I wasn't as familiar with until more recently was some of the federal student loan caps that are existing also within the same exact bill. And what this really came into fruition when I had discussions with prospective PA students and then also PAs themselves that take this bill and the cap, the loan cap, and they see themselves not being able to complete their education if those loan caps existed for them at this time. And that includes me personally, actually. So the prospective students are concerned because they are worried that they won't be able to pursue the career that they'd like.
Mhm.
And then also folks like myself that have already completed and are practicing clinicians wouldn't be able to do so in this type of an environment. And so that's where this came into play.
Now, for those who aren't familiar with the student loan cap and the One Big Beautiful Bill Act, tell us exactly what kind of numbers we're talking about.
Yeah, great point. So for physicians, they are within what's considered a professional loan cap, which I believe is 200,000 lifetime in terms of student loan borrowing through the federal government. Now, PAs and nurse practitioners, which is where the article does most of its centralizing, is $100,000 or less. Now, if we zoom out, how much does it cost to go to PA school?
Hmm.
It's about $100,000, and that's not with housing. That's not with food, because almost every PA student is not working because of the intensity of the programs. And that also takes into account that $100,000 includes undergraduate. So if you take that, the math just simply does not work. So if we look specifically at the student loan component of things, that immediately sends a red flag up for me that there's going to be less folks that are going into these professions. And then now the rural health hat that I wear, it effectively turns the water supply off
Hmm.
of a brand new fire truck that we're funding in the bill. And so there's where the paradox comes into play. And I think a lot of your listeners are likely to be aware of where I'm going with this. If we don't have a supply or a reduced supply in an area that's already hurting, we're not going to be able to fight the fire in the way we think we're going to be able to fight it.
So you're saying that applicants or students who come from rural areas after they finish, they tend to go back and practice in rural areas as well. So if their loans are capped, like you said, it threatens that supply.
Absolutely threatens that supply. And this is looking at it before, of course, the July deadline when it would be enacted. But I wanted to ensure that this article raises red flags for the fact that it does a great job of putting more money into the rural health pipeline, but it does not, it actually reduces the supply of what we would quote unquote use to fight the fire, which would be the clinicians.
So you mentioned that you talk finances with prospective applicants, of course, without any identifying information. Tell us about some of those conversations, especially in light of these loan caps. What are these conversations like? What are some of the questions that applicants are asking you?
Yeah. So there's two portions to that. I would say a lot of it's fear. First of which is fear that they may have less likely or be less likely to pursue the career that they're interested in, which in this case would be a PA or a physician assistant, physician associate. And then, secondly, if there's less PAs pursuing or less nurse practitioners being pursued in terms of, clinical sites or clinical clinicians in general, who is going to take care of those communities that they're already a part of? Now, of course, the answer is physicians, and that's absolutely the answer. But we also know that there's a declining supply in those particular areas to begin with. So, as a country, what do we do in these circumstances when we have an act paradox? And what does the clinician that or the prospective clinician do in these circumstances? And so that's really where the meat of the discussion that I've had with these prospective students has been. It's been a bit difficult because I don't have all the answers to these things.
So, what kind of options do these students have if they still want to pursue PA school, but their federal loans are capped? What options do they have?
So great question. So you still have $100,000 in federal student loans that, at least according to the bill, will still be available. Now, with that said, we know that at least in the PA profession, that number is well beyond the 100,000. And so there's always private options that are available, and they are somewhat diverse and also somewhat variable. Then there's also grants that are available nationally for folks that come from rural areas. And so those can also be quite helpful. And I question as I'm talking to you, Kevin, about this, if the rural health transformation bill itself would be helpful with this, but I don't particularly have an answer. That's certainly something that I think a lot of states will likely want to pursue and consider as the money starts to go into these states as they've applied for the Rural Health Transformation Program and bill. So, yeah, private loans are still available and there's still federal student loans, but they are capped. And so it does need the clinicians or clinicians to be would need to do a lot of legwork to figure out how to make up that deficit.
And in terms of the difference between government versus private loans, is it simply the interest rates? What other financial considerations does one need to make when considering one versus the other?
I think a lot of it's got to do, you're correct, with interest rates and the differentiation there. It's also availability to some folks that are out in rural areas. If they tend to have lower income, they may not be as formidable of an applicant to some private loans. So there's also concerns there. And so there's a lot of different things that need to be ironed out as we start to approach next summer when this would otherwise come into play. My hopes are that this is a discussion that starts to gain steam within the policy and within the government community, because I know there's always good intentions with a lot of these things, but we need to also be aware of the ramifications. And so we don't want our future clinicians to be overburdened with what they would need to do in order to pursue their education.
So, what are you doing as an organization? And certainly, you don't have to talk specifically about Saint Scholastica, but in general, for other people in your position, what are schools in general doing to address this issue and the fact that it may choke off a potential source of rural applicants?
That's a great question. I think it's a lot of folks are realizing that they need to become, and when I say folks, I'm kind of generalizing into the higher academic community, but they need to become creative in outreach to state organizations and maybe other federal organizations. And if they are academic communities that help with providing a vital service to the communities that they serve, then there needs to be some consideration in order for us to make sure we are able to sustain taking care of our own population. And so I don't know of specifics that I can attest to, I suppose, on the podcast, but I know there's ongoing discussions with local private sector loan companies, and then also with state organizations that may be of help.
So why don't we extrapolate the situation? Just tell us the worst case scenario if the applicants are tend to be more financially homogenous that don't need loans or this issue doesn't affect them. How does that affect the workforce going forward? And what kind of implications are we going to have when it comes to our healthcare workforce?
And this is where the thought of the creation of this article has come from. And so if we shut off the water supply to a fire truck that's fighting a fire, that fire gets worse, which is the point of ensuring we have this discussion today, because it's absolutely vital to the future of rural health and really the future of primary care that we are able to sustain a workforce. And by these loan caps, they effectively shut off the water pressure.
Do you have any insight in terms of some of the motivations behind setting these loan caps, especially as it relates to PAs and NPs in the first place? Are you allowed to speculate?
That's a great question. I'll speculate to a degree because, again, this is a nonpartisan discussion. I have no my political leanings are for the patients of the United States. And so the Rural Health Transformation Program is a fantastic step in the right direction for those communities. It's just the paradox of turning that loan or putting loan caps creates this environment where it almost becomes a moot point. And so to speak directly to the PAs and NPs in these circumstances, I would suspect that there's not a full understanding that by capping both of those professions, that could actually have a very negative effect on the public health. So to answer your question directly, I believe less likely there's less understanding of those professions and the circumstances of how they affect rural health patients.
We're talking to Kenneth Botelho. He's the director of the Doctor of Medical Science program at the College of St. Scholastica and a physician assistant. Today's Kevin MD article is Federal Graduate Loan Caps Threaten Rural Healthcare Access. Kenneth, let's end with some take home messages that you want to leave with the Kevin MD audience.
Yeah, a fire truck without water cannot put out a fire, and a rural health system without a training pipeline cannot survive. And so if you find this conversation to be beneficial or eye-opening, my recommendation would be to get involved and use our voices. Because a lot of the times the folks that see these type of things are the folks that deliver direct care. Because we see those faces every day. And so some of those folks have fear in their eyes. And so we have the opportunity to make sure our voices are heard and that we can help continue to supply appropriate high level care to our patients.
Kenneth, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Really appreciate it. Thank you so much, Kevin.